Good morning.
Hello.
How are you doing today?
I'm good. How are you?
Good, 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 very good. You saw where I communicated with your preceptor?
Yes.
Okay, so we're on for Friday. You know what I
Yes.
don't have? I don't have the exact address.
Oh, okay. You ready for it?
I'm ready.
7300 North Fresno Street.
Okay. Any
Yeah.
particular? Go ahead.
I was gonna say it. He said something about meeting him downstairs so he can get you a badge or something.
Yes. And
Okay.
there's probably visitors parking, right?
Parking is absolutely horrible.
It is everywhere. Why do
Yeah,
I
it's
don't know
just
why hospitals haven't figured that out yet.
I don't understand. And but yeah, there is visitors parking.
Okay.
A1 through 6 or 7.
Okay.
But you're going to go into the medical building, which is closer to A1.
Okay.
So just depending on how what time you get there. But usually after 8 o'clock, it's just bad.
It's horrible. Okay. Okay. Well, I will be there. All right. What do you have for our agenda today?
I don't really have an agenda. I was looking at stuff just to try to see if it was anything specific.
Okay.
Um, which I don't have anything specific. I've it's been a very busy week this week. Next week the chaplain's on vacation. So
Ah,
I am running the show.
you'll be the only chaplain.
Yes.
Wow.
Uh I will be well, we have we have a priest, a Catholic priest, a Eucharistic priest. We have a couple of spiritual care volunteers. And so I will be basically pulling the list and creating the caseloads for them,
Okay.
as
And
well as a caseload for myself.
as well as for yourself. Okay. And you said Eucharistic priest.
Yes.
It's not Eucharistic minister. It's an actual priest.
I was gonna say minister, but I stopped myself so because I assumed it was a priest because he does the Catholic people
He
and he
does.
gives yeah,
Okay.
he sees the people who are Catholic
Okay.
and go through the communion.
Okay.
That's all he does is
He
communion.
provides sacrament or Eucharist for Catholic
Oh,
patients, and he may be a Eucharistic minister and not a priest. So you can just ask. It's seldom that
okay.
a priest is willing to do that, but sometimes retired priests do. Does he wear a collar?
No, now that I think
He's
about
probably
it,
not a priest. He's probably a Eucharistic.
he does not
Okay.
wear a collar.
It's about getting the lingo. No harm, no foul.
So he provides sacraments.
Which is Eucharist, right, in their tradition, right. That's one of their sacraments. So they have ministers who are specifically trained and whatever their version of consecrating of them is for that ministry. And they are crucial because they volunteer in the hospitals and it's so important to the Catholic patients and staff.
Yeah. So they have one assigned to Kaiser and he comes in once a week on Thursdays. And then the Father Chica, he is a priest.
Okay.
He comes in 4 days a week. And then we have a couple of spiritual volunteers, and I really don't know what their title is spiritual volunteers. I don't know what their credentials are or what their background, but they also see patients, and so we create a list for them.
And the list you create for them is not by their denomination?
For the spiritual volunteers, it's normally the Christians, Christianity, and Lutheran, or none.
Wow, we only allow our volunteers to see people within their tradition
Oh,
because we know they're not trained as interfaith or persons of no faith.
right.
Yeah, because we don't want people proselytizing. So you're pulling the list, but nobody's giving you instructions on how to separate them.
Uh, just all the Catholic people go to Father Chica. All
That's
the
clear.
the uh the new referrals that come in, the new referrals or referrals by a social worker is seen by the chaplain. So that would be
Right.
either me or Chaplain Royce.
And then all the Lutherans go to the Lutheran volunteer.
Um, we don't have a Lutheran volunteer.
Oh, I thought you said you had a Christian and a Lutheran. My bad.
The Christian volunteer sees the Christian and Lutheran.
Okay, what's the difference between Christian and Lutheran?
I really don't know. I really don't know. But that's how Chaplain Royce does it. He says if it's really funny because in the week, so I just got trained last week on all of the charting and how to pull and interface and look at the hospital list and all of that. And so this week I've been working it. I've only seen one identified Lutheran person that identified themselves as Lutheran. And so he said to assign that person to our spiritual volunteer, Marie. Now, I didn't ask what Marie was. I know that she's Christian because I've had conversations with her. So, and then there's another spiritual volunteer. I don't really believe they get a lot of training.
Right,
It really appears that they say, I want to volunteer.
right,
I go to church, and so they go through the volunteer program,
right,
and then they get assigned to the spiritual care department.
right.
What I've noticed is in the last week, I think I've even though I'm learning, provided more training for Marie because she was like, I went in the ICU and there was nobody in there but family, so I left. And so I said, you could have talked to the family. It's okay to speak to the family. She didn't know. So I just feel like we're all kind of learn. I'm thankful that I'm in CPE, so I'm learning and I have people I can talk to and ask questions. Chaplain Royce is available and he wants us to ask questions. But it's for the spiritual volunteers, they're just not getting a lot of training.
How do you feel about that?
I mean, honestly, for me,
Mhm.
I think it's a disservice to them because I know how I feel when I don't feel like I have enough information or and so maybe I'm putting my feelings off on them, but only because of how Marie and I said them. Marie is the only one that I've actually been engaging with, but she's sweet as can be, sweet as can be. She's a Christian, and that's her whole background. And what she wants to do is to go with the patient and provide Christian care. Whereas I'm being trained as interfaith right now. So I'm trying to move away from, whatever the denomination is or whatever, and just provide spiritual care. And so our conversations, I believe pretty soon our conversations are going to start aligning because I'm hearing that she's going to be starting a part-time CPE program.
Okay.
I
Oh,
think in the Bay Area.
have you in our journey so far seen a feeling wheel?
Uh, yes.
Okay, great. I
And
said,
I think we
I,
have one posted too in the
oh,
office, in the
good. You have one
chaplain's
in the
office.
office. I try to have one posted wherever I am, but I don't have one right here. So good. I'm glad you have access to it. I asked you how you felt about it, and you told me quite a bit about Maria,
Mm.
but not so much how you felt about it. So how do you feel about it? So you said disservice, which is not a feeling, but
That's
how do you
ew.
feel about it?
I'm trying to think how to put in words. I'm trying to think about the word on how I feel. I, for some reason, and I don't know why I can't get past this feeling, but for some reason, I only feel bad for Marie.
You feel bad for Marie. Okay. Is bad one of those feeling words on your feeling wheel?
No, and I really wish I had the feeling wheel
Okay.
right here.
So that's an opportunity. It's just an opportunity, and we don't have to explore it any further here because this is really about you. But it's a wonderful opportunity. And enough said. You're aware. Gee, all I can say is I feel bad for her. But you're also clear. I probably do have some other feelings, but I just can't tune into them right now. So it's an observation, and it's something you can reflect on later or not, but it's just an observation. And, I'm going to remind you guys today we have didactics opportunities, topics that you all get to pick. And so you might pick feeling wheel. How the heck do we use it? And how do I help it help me? So, having said that, let's shift to your whatever you wanted to cover next. And you had mentioned to me you wanted to go over your outcomes and indicators.
Yeah. And if I'm approaching it right,
Okay,
um, as far as what I'm completing, uh, my understanding is the one column is my awareness,
correct.
and then the next column is um, how will I know that I have mastered that particular indicator or mastered it or um, practicing? How do I
Right,
know what would be
right,
the evidence that I'm practicing it?
right. You want to take a look at your actual chart? Do you want me to pull it up or do you want to pull it up?
So I would outcome indicator. Okay, should I share the screen? Is that
You sure can, just as it is. Great.
and the question too is, are you able to track it? I try to put the dates and I try to bold the current date, like
Yeah, that's fine. Let's start with the very first one. And can you switch to under view one page and it'll be a little larger to the opposite direction. It says one
uh,
page. Keep going. Keep
oh, right here,
mm-hmm.
one page.
You got it. Okay.
Is
And
that larger?
you can make it larger by going to the bottom where you are and just there you go. All right. Let's see. So this
Okay, is
one,
that good for you?
that is good.
Okay.
So this one is the spiritual formation and integration outcome. So that's the big category of the five. The particular indicator is narrative history. And the detailed explanation of it is formative, identify, transformative, experiences in your narrative history and their significance to your spiritual journey. So the first one you identified was I had some rough understanding about this concept before CPE. What concept?
The concept of how your narrative history um, intersects or interferes with when you're providing spiritual care. What?
Excellent.
Yeah.
Okay, that's clear. And so then the evidence of your progress is that I can now identify that my family dynamics as a child, where my parents were married but lived in separate households, was a formative
Formative.
in your life narrative. Okay. Now I understand the struggles I had with adjusting to being a wife and mother in my first marriage. I don't understand how that is evidence of your progress. The concept of two becoming one was far from my mind. Thankfully, in my second marriage, my husband and I sought help from our church and joined a group. We received guidance and training on yielding to one another. Participating in this group transformed our way of communicating with one another. Because of that experience, our marriage has lasted 30 years.
So
So
I think I didn't have a good understanding when I did that one.
that's clear.
Yeah.
No, I'm sorry. You said that under awareness of growing edges. So I'm like, okay, you're like, I didn't have a sense of this concept when I started. I thought that's what you was repeating. But where you're trying to give evidence of your progress is, to me, you are saying, I realize that family dynamics, so you're naming something, family dynamics out of of my childhood were formative in your understanding of marriage. The specific family dynamic is my parents were married, but they lived separately. So what was the impact on your spiritual journey? So I get, here's a dynamic. Family dynamics is something out of your narrative history. A specific family dynamic out of your narrative history is married parents living separately. Now take the step to how did it impact your spiritual journey? I understand how it impacts your marriage journey, but now just add your spiritual journey. Let's take a look at another one. Is that clear?
Yes.
Okay, let's take a look at another one. And the second one is great. Let's do that one. So here's the clue. The category is spiritual formation and integration. So that's what I'm going to be looking for. The indicator
Mm.
is articulate awareness upon reflection of when a care encounter intersects with elements of your narrative history. Do you understand the indicator? I think you do. Yes or no?
Yes.
Yeah, I agree with you. I think you do. And so, okay, this is what you're gonna your evidence. Hey, every individual brings not evidence, but where you are. Every individual brings a life story into the care setting. This could be positive, it could be negative, relating to family, culture, trauma, and values. Awareness means seeing the patient as more than a diagnosis or task, but as a whole person shaped by their lived experiences. My challenge is remembering this concept and being careful not to become judgmental. Okay,
Yes.
so your evidence of this progress in this is I find myself being more mindful when listening attentively in caregiving settings. Okay, what do you mean by mindful?
I'm trying to be intentional about what I'm thinking. Um, I'm trying to be intentional about being present
Okay.
and not for some and I just believe it's maybe from years and years of being this way. My mind is always thinking ahead. It's always
Mm-hmm.
going to what is this person thinking or what are they going to say? Or if I read something in the record about their history, or if remind me of something about my own history, I start formulating things in my mind. So I'm trying to be more mindful of that.
So what you mean, it sounds like you say, I find myself being more mindful to be a present, listening attentively and not thinking about something else. That's what you're saying. So
Okay.
you're learning to take your cue from the patient. Okay. You're also aware of your own narrative history and you're careful not to transfer it to the person. How is that progress upon reflection of when an interaction with a care receiver triggers something in you about your narrative history? So you kind of got close to it when you said, I may look at something in the chart, or I may be listening to something that is a part of my narrative history, and immediately I start thinking about that.
Mm-hmm.
Okay. That would be evidence of progress that you recognize in the moment you're doing that, and you're like, oh, I got to stop doing that. That's evidence of progress. So you're aware. You're articulating some awareness that you do that, and that's evidence of progress.
Okay.
Because you're right now at this stage, you just want to be aware upon reflection. So I would say to you, we were talking about this indicator. What what was it that you heard when you were with the care receiver that connected with your history? Was it that they just said they were Christian? What was it? What was it about them, what they were talking about, or what you read about them that connected with you?
Trying to remember which incident this was. It was something about, oh, I know what it was. It was the growing up. It was um the person was saying something about growing up. I forget what it was.
Okay.
But what happened, so, so when we had to do our life story, our life
Mhm.
share,
Right.
that was a like a aha moment, a eye-opening moment for me. Just writing, just going through my narrative, my life history. Um, I think I shared it. I just thought it was normal, the life that I grew up in,
It was.
all the way to now. I mean,
Right.
normal. It was normal. It was normal for us, but
That's
that's
right.
what it was.
It was normal for you.
But after um, talking about that and writing about it and discussing it and looking back on some of the things that has happened in my life, now I'm like, no wonder, I had this challenge and that challenge. And so because now I am so aware, if somebody says something to me about their family growing up, because of my new awareness of my family dynamics, I'm now starting to think about my family. I don't know if it makes sense.
That's evidence because you specifically are saying, hey, look back at the indicator. You're talking about your awareness, your consciousness now that you've thought about it upon reflection. When you're with a care receiver and they talk about growing up, you immediately think about your growing up and how it wasn't as normal as you thought.
Right.
That is evidence of progress.
Oh.
Okay. Over here, it's almost like you're trying to show a competence that you think the indicator wants you to have,
Right.
and you're not there. And unit one,
Okay.
you're right at awareness. Am I just aware? Okay. So that's what you
And
just,
it's okay to be, I think that's the frustration that I'm getting within myself. Is it okay to just be stuck at the awareness, or should I be saying what you're gonna do next? Like what?
well, I think you know you have an answer to that already. but you also have a judgment and you call it stuck. So
Yeah.
awareness is critical in order to do anything. You first have to really, to a degree, have a level of awareness of it, right? And that's what until you had awareness about family dynamic, you couldn't begin to have awareness about family dynamics and how it shows up in you as a caregiver, right? So you start
Right.
with awareness, but it's not stuck, it's progress. So you're aware now upon reflection here in IS. You're aware now upon reflection here in IS that you didn't really cover that indicator. You thought you did, but you didn't quite.
Right.
You're aware. That's progress.
Mhm.
Next level will be, okay, now that I'm aware of that in IS 2 weeks later, maybe I'll become aware of it eventually right after the visit. And then I might become aware of it in the visit. And in the visit, unit 4, I'll be able to change my behavior because
Oh,
so you just got to give yourself time. So it's not stuck,
yeah.
it's progress, and you're progressing. But we first want to get you aware of what that was actually, what that outcome and indicator was actually pointing to, not trying to fix it. Let's just get aware of it.
Oh, thank you. Okay.
Good. And that's why a lot of yours says articulate awareness upon reflection, because the skill you're building is the reflection. And then when
Right.
articulating awareness is your ability to express it. So you have an awareness now as a result of our conversation. I'm going to claim it, right? I could be wrong, but I'm going
Okay.
to that you have some feelings about Maria and her level of preparation to be a spiritual care volunteer. You have an awareness that you got some feelings, but you can't articulate what the feelings are. We just went through it, right? So I'm aware there are some, but if you continue to reflect upon reflection, then you'll be able to articulate what the feelings are. That's progress. And that's right where you want to be.
Ah, oh,
You can stop the screen share or we can continue to go through them. It's up to you.
okay. No, we can stop. That is really good. Lord
Good.
have
I'm
mercy. I
glad.
can't wait.
I know. I know. You keep trying to get to the next level. Just enjoy unit 1.
Yeah.
How was
Yeah.
verbatim? I don't remember seeing it. Did you send me your verbatim?
No, I haven't sent it. I'm still
Okay.
working on it. And
Okay.
I don't want to say I was feeling good about it. I was just doing what I was doing with it. And then I got Alice's
Yes. My heart went out to you.
16 pages.
My heart went out to you because I'm aware that you are in unit 1 and it makes sense. You're going to look to how other people are doing to figure out in part how to do your work. But you have to keep in mind unit 3, Alfredo, unit 4, that they have different indicators and skills that they are working on. So awareness upon reflection, that's where you are. So I want to encourage you to submit, release it, let it go. Spending a lot of time fine tuning it is probably not going to be nearly as beneficial as submitting it and spending time reflecting on it. There's no letter grade.
That's what Chaplain Royce told me the same thing. He says, because I told him
I
I had
like
to,
this chaplain voice.
I like him too. I really do. But so I was telling him, I said, I'm working on the verbatim. He's like, oh, your first one. And so, but he says, just do it. He said, don't just do the best you can with it. He says they're going to dissect it, they're going to help you with it, they're going to, and just be open to receiving. So he has helped me. He even offered to look at it if I wanted him to, but I want to learn. I really do want to learn this raw. So but that was before I saw Alice's, and that's it. Maybe I should have had him look at it, but No, I'm just about done with it, and I'm gonna just submit it as is and be open
That's right.
to feedback. And
That's right.
yeah,
Good.
my
Okay.
biggest challenge is verbatim, is the actual dialogue. Like, who remembers verbatim?
Right. It does say in there, sort of to the best of your ability. I was always amazed when I would sit down and do them immediately after a visit, like, oh, I'm gonna do a verbatim on this, how much I actually did remember. I was always amazed. And I don't think you need 10 pages of dialogue. Every, I did the longest verbatim I've ever done in orientation in terms of the dialogue. The reflection is longer, but the dialogue, to capture it. And you were very much able to say, yeah, you were horrible, right? You don't need a ton to,
Right.
but it was enough for you to say, hey, let's talk about this. What happened, right?
Yeah. Yeah.
So that's part of the process too. And that's part of why we invite the sharing in advance so people can, if they have time, to read it before. But also keep in mind, everybody has done a bunch of these. This is your first one.
Right.
So I'm glad Chaplain Bryce, that's great. He gave you good advice. So release it, please. Go ahead and let it go. And we'll spend some time. And you already know that I, to the best of my ability, facilitate a brave and safe space. So we're
Yes.
not going to be cutting you down and dissecting, every nook and cranny.
Yeah, that's one thing I really appreciate about this program. I really do. Um, because I feel like everyone, well, we're all just here to learn and support one another, and I really do feel like it's a safe space. So I am okay. I'm just hard on myself. I like to learn. I like to uh, do things right. I don't want to hurt anyone. And I think that's one of my fears, I guess you can say, when working as a chaplain. I'm getting better at it. I just don't want to go in and hurt anyone or cause anyone to feel worse than they
Wow.
felt after meeting me.
Okay. How
Yeah.
can you say a little more about that? You don't want to hurt anyone. You don't want them to feel worse after meeting you.
I don't want them to feel worse. I don't want to say the wrong thing um, and cause them to go into a space, a dark space or a deep space, and then I'm frozen and don't know how to bring them out. My pastor's wife, well, and my sister are both social workers, but they always talk about being careful about even when we're ministering in church, just getting people to go into those places where they're hurting and then not being able to help them out of them. And then we leave them there and now they're sitting there not knowing what to do. And so I don't want to walk into a patient's room and not and say something that triggers them, and then they go into a space that I can't. I don't recognize or I'm not aware,
That sounds like
and
a
I
lot.
leave them there.
Yeah, that sounds like a lot of pressure to bring right into the room.
I think because I'm at Kaiser, I'm used to working in a hospital where I have time. I can go back to a patient. I can, have another meeting. You can kind of redeem. Here, I see somebody one time and they may be gone the next day. So, and the caseload is pretty big.
Yeah.
So you don't have a lot of time, so I try to review a little bit before I go in, so you could know what's going on, but you just really don't. It's trial. Well, I don't want to say trial and error. It's just really being in the moment, and I'm learning that. Like this last week was a much better week for me as far as what I'm feeling, not as far as what the patient is feeling, because I don't know. But as far as how I'm feeling, I'm feeling a little more comfortable. still learning learning the open-ended questions. That's another area that is a challenge for me, apparently, which I didn't know
Oh,
until
so
I started doing this.
you're developing an awareness of communication style. And open-ended
Yes.
questions is one of those things sometimes referred to as communication style. So let me affirm for you your observation that it's so important that you be in the moment. That's as opposed to say the carefully well crafted question, although you want to learn how to do open-ended questions, or try to avoid triggering someone like you are as you step into the hospital room. It's as if you're stepping on a minefield and you're just trying to avoid
Right.
something off.
That's
That's a lot of pressure to bring in the room, and it's hard to be in the moment if you're
right.
watching for all that. So I want to really encourage you to be in the moment. And out of trauma-informed care, if someone should, as the social workers you mentioned said, bring up something very difficult from their past, something very painful, something they are now confronting again, you are able to listen, to acknowledge, wow, that was a pretty painful experience that you remembered, right? You don't even have to use the triggered language, but you know they've been triggered. You're like, and bring them to the present moment. You shared something pretty painful. How are you feeling right now? Bring them to this moment. And they're like, it could be, I'm confused, I'm angry, I'm scared. You don't know what it'll be. Whatever they say, can you say more about it? Because why is that coming up for you now? And you're pulling them into the present, right? You hear how that's what that's doing by just being curious. How's it?
Yeah.
And you have the ability to say, let's do some deep breathing. If you might not want to do 5 for all of the senses, and you might not want to do all the senses, you might just want to do 3. Name 3 things you can see right now. If the person has sight, name 3 things you can hear right now. Take some deep breaths. 3 things you can touch right now. And that's bringing them very quickly out of the triggered, more vulnerable space into the present. And then they, on their
Mm.
own, upon reflection, can go back to it. But you're not leaving them, as you said, all triggered and nowhere to go.
Oh, thank you so much for that. Wow. That's great advice. And I am just amazed that, well, I don't want to say I'm amazed because you have much more experience in education, but my 2 social workers who I'm very close to, neither one of them could tell me how to bring people back.
Was this, it's your
They just
lane.
told me, don't take them there.
And that was good wisdom. And it's your lane. That's your skill set that you have that they don't have. That's not their work. They just come in
Wow.
after, look at this. They done messed another one up and now I gotta, right? So
Yeah.
your lane, that's your skill set. That's what you're bringing. And
Oh, wow.
as your awareness increases, you'll be more and more able to do it. But you also want to have some skills. Like, okay,
Right.
and
Right.
and that's real simple. You know, when I give you the 5, but we can make it real simple. Instead of 5 senses, instead of 5 things, just real quick, can we do 3? Because it's just bringing them back. And I did it to you. I asked you how you felt about Maria, and it was real clear to me you could not talk about your feelings. You went all everywhere. And I said, well, let me make her aware. I made an observation, offered the tool, you have it, feeling wheel. And then I literally said, well, we can revisit that later. Let's move on to something else. And we did. I didn't let you get sunken in to all those feelings because you got some feelings, girl.
And
about
I
what's
don't,
going on with
yeah,
Maria. And you were
yeah,
able to move forward. And so we're doing it for each other. And I'm staying right here with you in this moment. And I don't have to worry that you're going to go away here brooding, perseverating, repeating over and over again in your head what's going on with Maria. You're like, I think you're real clear. I'm gonna go get this verbatim out. I'm gonna this to do. I'm gonna be able to move on. But it doesn't mean you won't ever revisit it.
right.
You got
Hmm.
this. You're doing it. You're already doing it. You're
Well,
already
thank you so much. I appreciate,
welcome.
I really appreciate this one-on-one time too.
Yeah.
It's a lot. The whole program is a little more than what I had anticipated.
Yeah. Yeah.
Um, but I am looking forward
I'm
to the
s-
growth.
I'm
I
so
really
glad
am.
you're here. I'm so
Yeah.
glad you're here. And I want you to know you're already growing. You already are. Okay. All right.
Thank you so much.
I will see you tonight. Let that verbatim baby go.
Okay, and
All
then I should
right.
send it out to everybody like Alice did.
Yes. Yes, it's
Okay.
helpful to me email it to everyone because what we'll try to do is read it before, even though
Uh-huh.
we're going to read it in group, but it allows us to have a more careful reading.
Okay, I'll do that.
All right. I'll see you tonight.
Okay, thank you.
You're welcome.